intersections of race and ethnicity, and the access to health and mental health care as it pertains to psychological well-being and distress of those living in the U.S. And his work seeks to demystify the ethnic and racial homogeneity of U.S. Latinx, render visible the lived experiences of Afro and Black Latinx, and contribute to the elimination of Latinx health and mental health disparities in the U.S. He is a recent arrival at Pitt, and we are really glad to have him here. Welcome, Jeffrey.
Thank you so much. Thank you everyone for inviting me to share some information about my work and the research that I'm engaged with. It's a pleasure. So I thank the Center of Latin American Studies for this space. And so yeah, just like Manuel had introduced me, my name is Victor Figuereo. I'm still getting used to Dr. Figuereo, so anyone here can refer to me as Victor or Figuereo as you wish. So I recently graduated my doctorates in 2020 and recently joined the School of Social Work as faculty in last fall. And so as a first generation scholar and Afro-Latino scholar, I wouldn't be here without the guidance and support of all my collaborators, mentors, family, friends, and faith, all of which have been very integral to my life and my work. And yeah, no, without further ado, as the title indicates, as you can see, my work centers around Latinx behavioral and mental health disparities, with specific attention to racialization, race, and ethnicity within. Next slide, please. And so first, just for terminology's sake, I'll be using the term Latinx to refer to individuals of all gender identities with Latin American, Spanish-speaking, Caribbean background descent. And I'll be using the term Afro-Latinx to also refer to individuals of all gender identities with both African and Latin American, Spanish-speaking, Caribbean descent backgrounds. And so I'm going to briefly first to share my journey to my work and highlight a specific study, and then finish with detailing just what are some ongoing projects that I'm involved with now and hope to further investigate. And so my journey has to my research has been a personal one. Next slide, please. I was born and raised in Boston, Massachusetts, raised by my two parents, Mommy and Papi, who moved from the Dominican Republic to Boston in the 1980s. And growing up, so currently I racially identify as Afro-Latino, but that wasn't always the case. I grew up being socialized that it was not okay to be Black. It was not okay to embrace Blackness in myself and my family. And, you know, whenever I would ask, whenever race was a topic in my household, you know, I would either be Moreno, Trigueño, Indio, different racial terms based on my phenotype, but anything but Negro, anything but Black. This was the case for a lot of us in my family. And so, and it wasn't, for me, it wasn't okay to really explore Blackness until I watched the PBS documentary Being Black in Latin America by Henry Louis Gates Jr. It was when I watched this documentary that really my eyes really opened a lot to conversations I wasn't familiar with, talking about how internalized anti-Black stigma in the Dominican Republic in one of the episodes, how that's traced back to colonization, to the transatlantic slave trade. And so watching this, it helped me to reflect my racial identity, helped me to reflect experiences of racialization in my life. For example, why did others in my life see me as Black, but my family didn't, right? Why did others see me as Black and I didn't? A common phrase among some Dominicans, including myself growing up, was, "Oh, I'm not Black, I'm Dominican. I'm Dominican, I'm not Black." And so curious about, where did that come from? Kind of thinking again about the socialization experiences. And so this, and so it helped me not only reflect on myself and my identity, but also it led me to my interest in exploring race and racialization in my research about Latinx behavioral mental health outcomes. Next slide, please. And so what do we know about Latinx mental health and behavioral health outcomes? What do we already know? We know that Latinxes are less likely that Latinxes are more likely to face many barriers to healthcare access, such as cost, language, transportation, stigma, and a lot of the research finds many differences in health and mental health outcomes depending on the nativity, depending on the immigrant status, the geography of Latinxes, and really indicating and showing that Latinx folks in the United States, we're not a monolith, right? We're very diverse. And one of the, being involved in this research, reading the literature, noticing that what was missing was the racial diversity. Diversity in skin color, diversity in how folks identified racially within Latinxes, right? That was missing from the literature about psychological distress rates, alcohol use outcomes, access to healthcare, and so forth. And so, let's see. And so, yeah. And so those have been part of the limitations to these studies, the lack of representation of Afro-Latinx groups and also Dominicans as well. And so scholars such as Edna Fuentes has called for increased attention to race, racialization, and racism as structural forces that may impact the behavioral mental health disparities of Latinxes. Next slide, please. And so it leads to the current gap in the research that we know little about the role of race and racialization. Next slide, please. Leading me to wanting to focus my research on understanding the ways racialization impacts Latinx behavioral mental health outcomes. And so guided by critical race theory, we know that racialization is part of a structural process that involves racial stratification that benefits whiteness under white supremacist culture, contributing to the different racial health and mental health disparities, particularly among Black individuals and Black groups. Next slide, please. Luisa Borel developed a framework looking particularly at the effect and impact of racial identity among Latinx folks on their health and well-being, hypothesizing and outlining that racial classification, this form of racialization, may lead to pathways, right, of illness and health inequities. Studies have supported her model, finding that darker skinned Latinxes, right, experience inequities in their lives, that they have lower socioeconomic statuses compared to their lighter skinned counterparts, that they experience more police arrest rates compared to the lighter skinned counterparts, that darker skinned Latinxes experience as well greater health illnesses, hypertension, for example, suggesting that Afro-Latinxes may be more at risk for distress, as Dr. Jasmine Mena has indicated in one of her studies. Next slide, please. And so I wanted to then, in one of my recent studies, I wanted to focus on and test, well, look at the question, does psychological distress differ by race and by ethnic? Next slide, please. And so for this study, I collected data from the National Health Interview Survey. So every year, they send out surveys for folks across the country. Telephonically, actually, they collected data about health outcomes and different variables. And so I gathered, I merged together multiple years of the data set in order to have a representative sample of not only Latinx as a total group, but Mexicans, Puerto Ricans, Cubans, and Dominicans as well. And so the total sample size for this study was about 34,000 or so altogether. And so with this data, I looked at the question, well, is race associated with psychological distress? And so conducting my analyses, looking at analyzing the data using data software, running multinomial logistic regressions, finding that there is a relationship that is significantly related to distress for Latinx folks. In particular, that Black Latinx, similar to what other studies have indicated, that Black Latinxs are more likely to experience distress compared to their white counterparts. And we know that, next slide, please. We know that because of colorism, because of the structure of colorism and the skin color inequities that many people face, including Latinxs, that this might be a factor, that this might be explaining why we see these different distress rates. Next slide, please. We know that that skin color does play a factor, and the Pew Research Hispanic Center has surveyed even Latinx folks, and Latinx folks themselves in the United States also believe that skin color does play a role in their everyday lives, that darker skin color makes it harder to get ahead in life, right? And so, again, skin color discrimination being a possible factor here. Next slide, please. My second question that I tested for this study was looking at, well, do we see this relationship play out for the represented ethnic groups, for the represented nationalities, for Mexicans, Cubans, Puerto Ricans, and Dominicans? I expected so, because of how global colorism is, because of how prevalent colorism is. But what I found was, unexpectedly, I did not find the relationship to be significant for Puerto Ricans and Dominican adults in the sample, only for Mexicans and Cubans. And so essentially what this finding is saying is, similar to the first question, Black Mexicans more likely to report higher levels of distress compared to white Mexicans, similar to Cubans. Black Cubans more distressed than white Cubans. But the distress rates between Black and white Puerto Ricans were very similar. And the same thing for Dominicans, that their distress rates were very similar. Next slide, please. So as you can see here, this is just also a visual representation of the psychological distress rates, right? And so kind of thinking about, well, what could explain why race was not related to distress for Puerto Ricans and Dominicans? One of the possible explanations I explored in this study, next slide, please, was the possible factor of differential access to insurance coverage. And so I noticed that in my sample that in the data set that Black Mexicans and Black Cubans most of them lived in the southern region of the United States, lived in southern states like Texas and Florida. whereas Black Puerto Ricans and Black Dominicans were more likely to live in the Northeast, right? It's important, right? The geographic context and differences of ethnic enclaves within Latinxes. But what could that mean when we think about healthcare policy, anti-immigrant policy in these different regions of the United States? We know that the Affordable Care Act, Medicaid expansion, that some states in the South have not expanded to this day, such as Texas and Florida. And so a possible explanation of why we're seeing Black Mexicans and Black Cubans with higher distress rates than their white counterparts, it could be perhaps of the distress of not having access to healthcare, having more of a barrier to having Medicaid. Whereas Black Puerto Ricans and Black Dominicans may have more easier access to Medicaid depending on where they live, right, in the Northeast. So it's important, something that was interesting, I thought was important to kind of think about in terms of the context of access. Next slide, please. And this is just a visual here. What you're looking at is a visual of the states that have expanded Medicaid and that have not. The ones in orange have not expanded Medicaid, as you can see. Some southern states like Texas and Florida, where a lot of Latinxes are represented. So another potential explanation as to why race wasn't significantly related to distress for Puerto Ricans and Dominicans is thinking about the context of colonization, thinking about the history of the transatlantic slave trade and the development of phenotype hierarchy in the Dominican Republic, in Puerto Rico, really in all of Latin America. And thinking about how that history has led to anti-Black stigma, has led to mestizaje ideologies. In the time of the nation building of the countries and lands, using mixed race to Nazi race, and essentially the Spanish elites at the time, emphasizing that, well, we're mixed, you know, from Euro, African, and indigenous descent, so race shouldn't matter. And they used that to try to resolve the racial inequities that Afro descendants were experiencing, right, on the islands and lands and countries. And so the prevalence of mestizaje ideologies, and also what it also led to was encouraged blanqueamiento. It encouraged preferences to whiteness. For example, mejorando la raza, in terms of encouraging intermarriage with lighter skinned folks, with white folks, in order to breed out indigeneity, in order to breed out Blackness from one's family. And so this historical context, I found was important to discuss and talk about, and to try to contextualize why we weren't seeing distress rates between Black and white Puerto Ricans and Dominicans. So it could be that Dominicans and Puerto Ricans in the sample, those that are identifying as white, they may have a preference, right, for whiteness, right? So you're like, oh, I'm white, but they may be racialized, they may be ascribed as Black by other people. So therefore, they may still experience skin color discrimination. They may experience these similar distress because of that, because of this racial mismatch that they might be experiencing. Next slide, please. Which is what Wendy Roth had explored in a qualitative study she conducted, where she had a sample of Puerto Ricans and Dominicans in a qualitative study, and looked at the different dimensions of race and how they reported, and finding that some of the Puerto Ricans and Dominicans who self-reported as white they reported that they were ascribed as Black, right? Again, this racial mismatch. And so that's just a little bit of how I used the legacy of colonization, just this important history that has had ramifications that still does today in terms of how we see ourselves, how Blackness has been erased, how Blackness is still a stigma, and how whiteness is still something today that people try to attain to maintain privilege, to gain access to resources, right? So yeah, that's just a little bit of what we explored, myself and my mentors, in this study. Next slide, please. But it's important to understand that there are many limitations to the study, given that, again, it was, my study was quantitative. It was using a data set that didn't have multiple dimensions of race, that weren't asking about street race, was not asking about skin color, was not asking about discrimination or colorblind racial ideology. All factors that I believe are important to the racialization process, that could have implications to the psychological distress, behavioral, mental health outcomes of Latinx folks. Yeah, next slide. And so this was a study that was recently completed in the last couple of years, and so very recent, actually last year. And so currently, the research that I have in development, next slide please, is wanting to look at, again, these multiple aspects, these multiple areas that I believe are related, but haven't been examined. So trying to understand the intersections of different social statuses of Latinx folks and their multiple dimensions of race, right? How do these different lived experiences, how are people experiencing racialization factors such as discrimination, and how is that, again, impacting, how is that leading to perhaps their distress, alcohol use outcomes, and differential access to care? Again, it's important to understand and to use intersectionality frameworks and critical theories of race to, again, to point to systemic forces such as racism, cissexism, and homophobia, to understand just how intersecting these systemic forces are that work together with white supremacy to impact our lives in different ways, and particularly Latinxes, who again are very diverse in these aspects. And so I hope to further investigate these relationships. Next slide, please. One of the studies that I've also been recently completing, that is actually did complete and is under review, is looking at the predictors of race, of racial choice. Okay, so what factors are related to folks choosing white? What factors are related to Latinx folks choosing, Black? Particularly looking at ethnic group, immigrant status, and socioeconomic status as predictors. Yeah, and so that's just one of the current studies I have, and yeah, I'm hoping to have many more soon, and some are currently in development, very early stages, but yeah, this is basically just what I have for everyone here today, and I just want to really thank everyone for their time. Next slide, please. Yeah, just sample references, and next slide is thank you, everyone. And yeah, I can just open it up for just any questions, just, for discussion. I'd be happy to have.
Well, thank you. I have many different questions. I'm a historian, and I do slavery and race in Brazil. And so there are some things that I found that are interesting especially thinking about this idea of racial choice and how it changes depending on where you are, right? And when too, as you were saying, over time. So one of the things that I find really interesting is that in the census of 2010 was the first time that the Brazilian population was majoritarily of African descent, even though it has always been that. So it's the population didn't change, but what changed is the way that people were saying who they were. So this is the idea of, and this was it's just 51%, according to that, which is not much. It's if you look at the population, probably would see a much higher number. But that was the first time that happened, and you can see it. I'm very interested in this process of racialization or de-racialization, and how the same person defines itself differently, not just over time actually, but in different circumstances. And so I guess that's my first question. If you found people claiming some sort of whiteness or not, depending on where they were. So if you're at school, among, let's say, your peers, or if you are in a white hospital where you just see, if that changes, because I have, this is something that I think it's very fluid. So here I am Afro-Latino, but here I'm not. Here I'm a Hispanic, whatever. So that's one of the things that I was thinking, that if you found that, and it makes, I think, your research, which is wonderful, much more complicated too.
Yeah. So many factors, and just as you're mentioning, the factor of context, when and in what setting are folks identifying as white or black or even other races, other identities. I think that is very important to consider. Again, given that we think about, again, healthcare access and the access that whiteness can get someone, right? Identifying as white can perhaps, for one, thinking, well, I might have an easier time, I might have as hard of a time getting services, so I'm gonna identify as white. The fluidity is important, and it does make it difficult when looking at these data sets that a lot don't account for the fluidity. It's really hard when you're not asking folks in interviews and using focus groups to understand how folks are experiencing racialization, experiencing racial identity in different contexts across time, across different places. I think that's a very fascinating question. Yeah.
Because I was also, I think that one of the outcomes that I can see from your research in the future is precisely how it can create specific public policies related to mental health, like directed to Afro-Latinos, just because of the colorism aspect that you highlight, which is probably not just a self-perception, but an overall perception. So but I think that the self-perception is a very powerful way, as you have this in a national scale, how you can claim that that specific population needs and deserves a specific eye on it, right? But and then precisely talking about that, so you work with 4 national groups. Yeah. And I was wondering about them, or about maybe in the future you have, any idea of expanding the national within Latin American groups, if that matters, if that makes any difference. I know, for just because I'm Brazilian, that there is a big, large population of Brazilians in the Boston area, for instance. I don't see, at least until now, Brazilians, and if it's hard to define themselves as Latinos, Afro-Latinos, it's even kind of further. So I was wondering about not just Brazil, but about, other national groups and how different your, an outcome of a research like that can be if you include more.
Yeah, no, it's been one of the also limitations. For example, one of the other ethnic groups in the data set is Central and South Americans. The issue is they group together Central and South Americans as one group, rather than, you have Puerto Rican, Dominican, and rather than Ecuadorian, Guatemalan,
Yeah.
And so forth. And the issue, right, there's so many differences, socioeconomic differences between some Central American groups and South American groups. And just the access to quality of life in the United States. And so I think it's very imperative that we be intentional on including as many nationality groups, as many groups as we can, in order to understand, again, how folks are experiencing racialization. Could they be experiencing racialization differently? I think about, again, anti-immigration policies and how that can intersect with racism, right? Having darker skin, that making one susceptible to racial profiling in a state where there are more ICE raids, for example, where there are more detentions of folks without documents. And so, and folks who live who are born here with mixed-status families. And so I think it's important because different nationality groups of Latinx have different immigration histories, different points in time, at different times where ethnic enclaves have moved in, and in different areas again too as well. And so I think for also those reasons, so imperative to continue gathering data as much as we can among as many nationality groups. Latinx has come from over 20 countries and lands.
Yeah.
Right. And so,
And
those lands have their histories too.
Yeah, and what's the factor? What is the national factor in this sense of creating a community, which is sort of the mediation between the individual and, let's say, the healthcare system, right? So as if that community is a national community, how does the nation, what is the role that nation plays on your connection to the system? If you live in a community that is not just Latino, but Mexican or Puerto Rican, because I think that the role that the nation plays is really huge, and you're showing that, right?
Actually, I was wondering if you, by chance, did a comparison or actually followed up on the intuition about access to health, where Medicaid has not been, where the benefits have not been extended. If you were able to compare, let's say, the Cuban from Florida to the Cuban from Georgia, and et cetera. If were you able to pursue that angle, or was the data just not?
So this study was part of my dissertation. I did 3 studies. The second one was following that up, was an attempt to follow up on looking at the intersection of race, nationality, ethnic group, and Medicaid coverage, and whether we saw different groups having different distress rates, right? And there's of course limitations, but found that, remember correctly, that Afro Puerto Ricans and Dominicans with Medicaid coverage had lower odds of reporting distress. They were less likely to report moderate levels of distress compared to Mexicans and Cubans with, even with Medicaid coverage, right? So I did in my dissertation attempt to follow up, and that's just a little bit of findings that I found, which again suggests that this could be an actual factor, right? As expected. The limitation is it's difficult as to determine, well, is it because actually groups have more distress that they then have more access to Medicaid because of their high distress? Or is it the Medicaid that's actually reducing the distress? Like what, like the order, it's hard to really interpret the relationship there, because again, the data is being cross-sectional, like, you know, unable to have the benefits of longitudinal causation.
But in other words, were you able to, like, say, compare by state the same group, subgroup?
Unfortunately, no.
Oh, okay.
Unfortunately, yeah, not by state, only by region. The publicly accessible data was locked into the regions. Yeah, I think the restricted data, you could get into state level, individual state level data. But I think at that point, I think it would be again difficult because of the sample size. Would just get
Right, because
smaller.
you're gonna be also, it's going to vary widely in the states, because some states will have like almost none from one group and maybe a lot of another group, and so it.
Exactly. Especially when you look into race that very Black versus white, and which again is more encouragement and more needed for these data sets again to just take into these limitations into account to increase recruitment and sample size of folks.
Lisa Ricky said, yes, I appreciate the consideration of the, in quotes, potential structural impact of healthcare and regions. And there's about 9 people on Zoom, so if you have a question, feel free to unmute yourself or write in the chat. If anyone has a question.
While we wait to see if there is anyone from the online audience. So are you or your family still connected to Dominican Republic? Do you have family members there?
So a lot of us, actually, a lot of my external family members moved to Boston in the past 10, 15 years or so. But yeah, no, I still, tengo primos, tíos, tías, still in DR.
So you go there often or not?
I haven't been there since I was 14.
Oh, wow.
Yeah, it's been a long time since I've been there. So my immediate family, we don't visit often. It's usually my grandmother who comes every so often, a couple times a year, and a couple of my aunts. But yeah, no, so in a way, I know I'm kind of distanced. I've been distanced from being on the island, actually understanding the current political atmosphere when it comes to race there right now. I mean, the extent of the anti-Haitianism,
Right.
and even that's going on, that has been going on and still going on today. But
that's why actually I was going to that direction, which is, this whole racial identification that is sort of a more recent process, as we're saying, that you didn't grow up Black or Negro, but then it's something you become. It's after your family moved to the US. And I was going to ask what you would be there and how, your family, how they would be identified in the Dominican Republic.
I think if I was there, and like I've experienced this like when I was younger with different memories. So it's interesting. My mom would probably be trigueña, would probably be, I mean, for me, it would be for definitely my family, for Moreno, trigueño for me as well. And I think, again, it'll just also depend on the context, on where we are on the
Yeah.
island, right? And
social class,
and
right?
social class. Yeah, oh, yeah, yes. But again, no, but I've had other Latinx folks. It's interesting. So when I've been around Dominicans in Boston, I mean, they can spot me out if I haven't met them, right? I'm Dominican. Like, oh, eres dominicano. Like, yeah, no, sí, sí. And sometimes like I'll be referred to, oh, negro, ven acá. Right? And it's interesting. Like I haven't like analyzed, oh, what were these situations? Where was I at what point in time? But no, by different people, racialization, being racialized by others, it definitely changes. It can change by the person, but
Yeah.
and their exposure as well. What that person is exposed to when it comes to race.
Yeah, because I could, for instance, in Brazil, I could see you being from black to moreno, mulatto, or white. You could be all of them, depending on the circumstances. So it's really this kind of the connection that I think that you also put out so well of the disparities between the ways in which you self identify and how you are seen or racialized by the others.
I've never seen a chart like the dimensions of race identification, and the one specifically interesting aspect of it is the interaction base.
Yeah.
And when we're talking about this conversation of like how fluid race is, and it's really like subjective, I guess. I was talking to my friends from Mexico one time, and we were talking about colorism in Mexico. Obviously, it's like such a colorism is such a large topic in Latin America. And he was explaining to me the impact of having an accent from Mexico City compared to other regions in Mexico. Like people tend to think or pay more respect to you or something if you're from Mexico City. And I was wondering, like, is that would be part of sort of an interaction based part of race as well, or how that would fit in?
Yeah. Language and accent.
Yeah.
Oh yeah. I think accent and even dialect too. I mean, I don't know a lot about the relationships between different dialects and in terms of how one is seen by others in terms of race, but I know there's coded language. I've heard coded language. For Dominicans, for example, oh, if you talk a particular way, you're from this region, which happens to be a lower socioeconomic, people from lower socioeconomic backgrounds, right? And so then people racialize depending on your accent, dialect, be associated with social class. And so, no, that would be very important to also to look at to include.
That's super interesting.
Goes back to this how racialization is like not only a person can be racialized, but a person's accent, a person's religion can be racialized, right? And so
sorry to cut you off, but Lisa Ortiz on Zoom has a question. Lisa, if you want to unmute yourself.
Hi, everyone. Hi, Victor. So happy to be here and hear about your research. I wrote in the chat that I also, in relation to one of the previous comments, was also thinking about race as it relates to recent considerations in Puerto Rico, in general, and many groups similarly to groups in the States are really demanding more attention, rightfully, right, in relation to the experiences of Black Puerto Ricans and other communities, Black Latinx communities. And I was also thinking about that in terms of in Puerto Rico, for example, and access to mental health. So that I just wanted to comment, but as I hear you talk about racialization and how folks, might self-identify, I'm wondering, maybe this isn't even a question, it's more of an offering. I'm thinking about that precise resistance and like the movements that we're seeing with regard to Black communities in Latin America, in the Caribbean, in the US, claiming space, right? rightfully and engaging with a lot of movements online, in person, on the ground for not just representation, but real change. And so I'm wondering how that might look favorably with regard to mental health, right? Like approaching recognition and countering, right, all these structural inequities in a way that maybe has helped communities in some way, right, with mental health and exposure. So I don't know if that's a comment or a question, but it's what I'm thinking about as I was hearing you talk about, and I don't know if do you know if there's work that has been done? Because I think it's like necessary to demonstrate, right, like those structural inequities, and at the same time see how perhaps these movements might help in some way be avenues, right, for like mental health in more positive ways.
No, thank you so much, Lisa. Yeah, no, I agree 100% that, right, like what are the current, what's resilience look like, right? And we know we've seen it, we see it in the movements happening. And so how can that, right? How can we explore that as to use for folks to improve their health, to improve their mental health, to heal, to have a healing space, what it is to reclaim Blackness, to be around folks who get it, who understand the inequities, who understand the microaggressions of having darker skin or being racialized as Black, and again in atmospheres where some folks again face a lot of erasure, where those conversations may not be as possible. But yeah, no, I think that would be very, very crucial as we think about how do we then address mental health inequities? What are healing spaces, and looking at movements as it relates to that?
Yeah, because
I don't
I'm
know- I
thinking
don't know
even
if
your
somebody-
experience. Oh, sorry, somebody's talking over there.
No?
Oh, I was just gonna say, even your experience, how you opened the presentation, right? And now being able to witness you talking about your work from a personal and academic perspective, right? Of that whatever shame or, sort of like erasure that existed, like we're moving away from that, right? Intentionally. And so it's great to have heard that story, and then, kind of like seeing how very tangibly there's that reclaiming that's happening, right? In powerful ways. So I just wanted to share that.
Thank you, Lisa.
Anyone else on Zoom? Have a question? Great.
Yeah, well, it was really, really, really interesting and leads to so many different interesting fields and possibilities of discussions. Yeah. Yeah, I was curious, and again, as we were saying in the beginning, it's too bad that the time of the semester doesn't help in terms of engaging with our, with our students. Because I was wondering, if like a mini version of what you did could be done among our students. Let's say it's like PIT students.
Yeah.
So Afro Latinos versus Latinos or versus white, and how they think about, let's say, school stress, right, and their mental health as students post-pandemic or at the end of the pandemic or whatever we are. But so I think this kind of interaction could lead, and maybe, connecting to the student clubs. That's why I asked you. I think would be an interesting way. I mean, where are those students from in terms of like your national categorization? How they define themselves, like racially define themselves, which for generation, I think that you would see much more Afro defined than, older people. But, and then if they sense differences, this whole idea of how, in a campus that is heavily white, which was a surprise for me when I arrived here. Even coming from a place, Brazil, which is the access of higher education is still very racialized. I had a much more diverse classroom in Rio than I have here. So thinking about that, what does it mean to be the only, let's say, Afro and Latinx in a classroom, for instance, which might happen very often. So I don't know, I'm thinking out loud, but I think will be a great sort of way to approach this group of students and maybe, have them think about this sometimes they think about this in an individual way, and what you're showing is that this is really not the case. It's about the broader categorizations.
No, definitely, it's such a also important space to explore because there is an interesting study that looked at explored college students, Latinx college students, and differences in socialization experiences growing up between non-Latinx Black college students and Afro-Latinx college students. And of course, finding the differences where the non-Black Latinx Black students, they experienced positive socialization, right? To be proud of being Black. And the opposite was found for the Afro-Latinx college students, right? And so to understand, to see as education as being a space, interestingly, it could be spaces of predominantly white spaces, but could be spaces where healing can happen in terms of, wow, I can talk about, I'm being exposed to folks who haven't been exposed to before about talking about Blackness in the history of their countries or their families, how educational spaces can be spaces of healing as well. I mean, higher awareness and exposure, as it was for me. But it was interesting to see that study and to think about your recommendation of looking at and talking to college students here about their experiences, their racial identity. And so, yeah, it's there's so much crucial areas to explore.
Yeah. Well, thank you so much. I think, this is really, and it's just the beginning of the conversation. So hopefully we'll continue that, and it will be great also for us to get any kind of connection that you feel about having with the center in the sense of, I don't know, developing collaborations or thinking about this thing with the students. I think would be really nice.
I would love to talk more.
There's some chats, there's someone that wrote in the chat that they were happy to help with the research.
Okay.
On the floor thing.
Oh, that's on. Of course it's on.
Thank you.
Yeah.
Thank you everyone who joined over Zoom. Thank you so much for your time. We really appreciate you joining, your questions and comments. Thank you.
Yeah.